Vamos a continuar con la siguiente presentación. We continue with the last presentation, Immigrant Effect and Socioeconomic Gradient in Cognition by Nicholas Bishop from University of Arizona.
Hola, buenos días. Soy Nicholas Bishop y es mi placer presentarles hoy. Mi español no es muy bueno, así que si me disculpan, presentarles en inglés. Thank you. I'm Nicholas Bishop, and I'm happy to be presenting here today and sharing our work on immigrant effects and socioeconomic gradients in cognition among Mexican origin older adults. I have our great team of co-authors listed here, and I'll start by saying we have no conflicts to disclose. So I want to start by emphasizing the importance of studying cognitive outcomes among Mexican origin older adults in the US and Mexico. So as we know, population aging is an important topic, and Mexican origin older adults are aging rapidly in the United States and Mexico. Cognitive impairment, as well as Alzheimer's disease and related dementias, represent some of the most burdensome age-related chronic conditions because there's very few effective clinical interventions that can be used on these, and the extreme burden that is imposed on the individuals affected by these conditions. Unfortunately, the burden of cognitive decline and ADRD among Mexican origin older adults is really amplified by socially patterned health disparities. So in the United States, US Hispanics experience poverty at nearly 3 times the rate of non-Hispanic whites. And then here in Mexico, there's several intersecting barriers to good health, including high poverty rates, limited access to formal education, as well as kind of other factors. Unfortunately, assessing cognitive outcomes among Mexican origin older adults is complicated by several confounders, and of particular importance to my research, specifically migration status and educational attainment. So in the United States, Hispanic immigrants tend to have better health outcomes compared to residents of Mexico, so kind of in their home country, and oftentimes compared to US-born Hispanics, and this is described as an immigrant health advantage. Possible reasons that this immigrant health advantages occur among many explanations include selection effects. So this idea that healthier immigrants, or I should say immigrants are healthier, so we have healthy migrant effects, and then also return migrants tend to be unhealthier, so it's described as a salmon bias. So these are of interest to me particularly. And these selection effects may contribute to the immigrant health advantage in terms of measurement effects, and it might be an artifact that you need to look into. Also, education is kind of a central confounder of identifying an immigrant health advantage, because education is directly related to cognitive outcomes, specifically through kind of patterning life course socioeconomic exposures, as well as developing cognitive reserves. Also, education is directly related to migration patterns. Immigrants tend to, immigration habits or decisions are related to education. And then also the effect of education on cognition appears to work differently for individuals with different migration backgrounds. So taken together, we have population aging among Mexican origin older adults in the US and Mexico, and we know that cognitive impairment is one of the most burdensome conditions. So further work to examine possible factors that might be targeted to reduce population burdens of cognitive impairment are really of critical importance. So what I'm doing and presenting today is the work that I've been doing using cross-national data as well as harmonized cognitive measures to examine differences in cognitive outcomes by country of residence and migration status. So to kind of move forward, the research questions that we were testing and I'll be describing today are: first, is there evidence of an immigrant health advantage in cognitive function or memory? And second, is there any evidence that migrant selection might be kind of driving or explaining differences in cognitive function or memory based upon country of residence and migration status? Finally, I'm interested in whether the effect of education on cognitive outcomes varies by country of residence and migration status. So the data that we used in our study come from the Health and Retirement Study and the Mexican Health and Aging Study. So the Health and Retirement Study is a panel study of older Americans in the United States. It's a biennial study. And then the Mexican Health and Aging Study is a panel study of older adults in Mexico, age 50 and older. We're specifically using observations coming from the 2016 HRS and the 2015 MHAS. And then we're also including the measures from the Harmonized Cognitive Assessment Protocol. So this, the HCAP study is a sub-study of both the HRS and the MHAS, and it includes several measures of cognitive outcomes, specifically among a subset of these samples. And because these studies are developed to create or enable cross-national comparisons, they can be used to investigate the effects of migration on cognitive outcomes. So I'll describe the HCAP study that's embedded in the Health and Retirement Study as the HRS HCAP, and then the HCAP that's embedded in the MHAS as the MEXCOG. In terms of the individuals included in our study, individuals were aged 65 or older at the time of completing the HRS HCAP or the MEXCOG. Individuals were self-respondents, and in the HRS, we restricted the sample to individuals who self-identified as having Mexican ethnicity, or all of those older adults that were living in Mexico were assumed to be Mexican residents. Also, we excluded individuals that had missing information on migration status. So after these selection criteria, around 1,400 respondents were included in our analyses. The primary outcome of our study was indicators of total cognitive function and memory function, or kind of memory performance. So the HCAP includes several cognitive tests, including domains of memory, attention, executive function, language fluency, and visuospatial ability. The construct of total cognitive function combines all of these domains together. We specifically focused on total cognitive function and memory, as these were identified to have positive measurement characteristics in both the HRS and the HCAP. So these harmonized factor scores that were analyzed were developed using a process of pre-statistical harmonization and then assessment of differential item functioning. And then the scores themselves are scaled to the distribution of the HRS HCAP. And the mean of these factor scores is 0 with a standard deviation of 1, so Z scores. The primary, or one of the primary independent variables in the study was an indicator of country of residence and migration status. So we identified individuals from the HRS who responded that they were born in the US and who identified as Mexican. And then we have those HRS respondents who identified as Mexican and who said that they were immigrants to the United States. In the MHAS, we have those individuals who stated that they've never worked or lived in the US. And then we also have those individuals who had at one point worked or lived in the United States but had returned to Mexico. The other primary independent variable was educational attainment. So we used adjusted international standard classification for education scores to operationalize educational attainment. And the ISCED provides a nice way to harmonize educational attainment across countries that have really vastly different educational systems. So we modified the ISCED because several respondents in the MHAS either had 0 or 6 specific years of education, so we modified the original ISCED to identify these levels of education. So you can see kind of the 6 levels of the educational attainment variable that we had, and this was analyzed as a categorical measure. So we included several covariates to control for alternative explanations, but due to time constraints, I just won't go into those here. In terms of our analyses, what we used was a pooled data set that included the harmonized measures of cognitive factor scores and then harmonized covariates. And so this was, bringing together all of the respondents from the HRS and the MHAS that were included in our analyses. We weighted analyses based upon person-level sample weights that were standardized, so each sample contributed proportionately to the pooled sample. And then we used weighted linear regression models to, one, identify if there were differences in total cognition and memory based upon country of residence and migration status, and then also to test whether there was evidence that education impacted cognitive outcomes differently based upon country of residence and migration status. So here we have kind of our initial descriptive statistics. I won't spend too much time describing these. Oh, I'm sorry. I thought I had some little boxes here. But to begin, US-born Mexican older adults had the highest total cognitive function and memory scores, and then this was followed by US immigrants. Residents of Mexico had lower total cognitive function and memory scores. And then in terms of education, the distribution of education among US-born residents, I should say, was much higher than US immigrants as well as those residing in Mexico, regardless of migration status. So these are unadjusted predicted means with confidence intervals of total cognition, which is on the left-hand side, and memory, which is on the right-hand side. And then we have these broken down by country of residence and migration status. So these are unadjusted estimates, so these are just kind of, the mean estimates that are plotted here. And you can see that individuals living in the United States, whether they were US born or immigrants, had higher total cognitive function and higher total memory than individuals living in Mexico. And this was really regardless of migration status. So now these are the same kind of estimates, but these are only adjusted for education. So you can see that by adjusting for education, we've really explained all of the differences in total cognitive function based upon country of residence and migration status. On the other hand, that's not true for memory scores, right? So even after adjusting for education, Mexican origin older adults in the United States had higher memory scores than individuals residing in Mexico. And what this really kind of points out is that education was not associated with memory function for US immigrants. So to kind of further, dig into that, this is a plot of these estimated means, but now they're broken down by each level of educational status. And what you can see for individuals with less than a complete primary education, which is kind of representative of 6 or fewer years of education, US immigrants have higher total memory scores or higher memory performance than non-migrant residents of Mexico, as well as return migrants living in Mexico. Because we had so few US-born Mexican origin older adults with very low education, you can see the confidence intervals are quite large, so these comparisons were non-significant. So in the end, our results provide support for an immigrant advantage in total cognitive function and memory because in the United States, US immigrants had comparable total cognition and memory as US-born residents, despite having much lower educational attainment, right? And then second, our results do provide some evidence of possible selection effects that might be driving this because, even after adjusting for education, US immigrants had better memory function than the residents of Mexico, whether or not they were return migrants or not. Also, our results suggest that there are educational gradients in memory that are specific to US immigrants, right? And this, I think, is kind of the most important finding from this research, is that education was not associated with memory function among US immigrants, which is very counterintuitive given what we know about the primacy of education in developing cognitive reserve. So there were a few limitations that, I kind of want to note. We're using cross-sectional data, so we're using only the 2016 waves of the HRSH cap and the MEXCOG. And also due to limited sample size, we were unable to test some important kind of follow-up questions, specifically whether these associations and differences are patterned by sex and gender. Also, it's important to note that cognitive tests may be biased amongst those with very low education, which is a large proportion of our sample, although this is kind of just inherent to the work that's being done. So to summarize, it's really important and to encourage everyone to continue to advance this work to better understand kind of what are driving immigrant health advantages, especially in memory function among US immigrants, and then really trying to dig in deeper into understanding what are the protective factors that prevent low education from harming the memory function of US immigrant Mexican origin older adults. So while that's true, on the other hand, we're also seeing ceiling effects in memory function among these US immigrants because they're not enjoying higher memory function at higher levels of education. So there's also these social barriers that are probably preventing them from kind of capitalizing or realizing these cognitive benefits of higher education. Finally, I think it's really important to note that the research being done on the immigrant health advantage, especially in the United States on Hispanic older adults, really needs to be updated and reconsidered given the current marginalization of immigrants in the United States and how this is influencing migration flows and patterns and how this will play out in influencing disparities in health that manifest in older adulthood. So thank you all for your time. If you have further questions that I can't answer today, in English or Espanol, please email me. Thank you.